sadly, things brushed under the carpet don't actually disappear. But if we were to air them and talk about them, discuss them, we might be able to plan better. We could perhaps explore options. We could discuss possibilities. And by not doing all this, we just deny ourselves. So this lack of communication in certain areas between doctors and patients and caregivers creates gaps in a cancer journey. And today we will try to bridge those gaps by connecting the dots. So our main speaker today is Dr. Harit Chaturvedi, Chairman of the MICC Institute of Cancer Care, a highly respected and well-known oncologist. With him is an equally esteemed panel of experts. We have Dr. Nikhil Agarwal, Dr. Sandeep Batra, Dr. Dodul Mondal, and Ms. Hiba Siddiqui, all specialists in their respective fields of surgical, medical, radiation, and psycho-oncology. Today's session will be moderated by Dr. Bhuvan Chugh, who is a medical oncologist. Dr. Bhuvan, may I request you to take over, please? And may I also request everyone to keep their microphones mute? Thank you.
Thank you, Radhika, for giving us this opportunity. Rather, thanks from all of us. So I think you raised some very pertinent questions, and I think these are the communications, or these are the conversations they better had than not had. And I think let's begin by Dr. Harit giving a few words about it, and so that we can set the entire process in motion, and then we'll obviously have a panel discussion about it. Harit, sir, please.
Yeah, thank you, Bhuvan. Thank you. So I think Radhika said it all, that we generally avoid these conversations because they are difficult and they bring up some issues which we actually are very uncomfortable, whichever reason, whether it is the outcome, whether it's related to the anxiety factors, whatever, but these are very pertinent. Unless they are solved in time, we can connect with it. Unless they are solved in time, we're not able to leverage what this situation actually provides to us. So what I'm saying by so every time there's a crisis, every crisis also comes with an opportunity. So I will just, and also I would say that every situation is special in several ways. One second, just he's setting up the, I had shared few slides. Okay, fine. So so actually I've got this picture here because what happened in 1986, I was a junior doctor and I was very keen to contest or be the students union president, so to say, and be active in the union netagiri and all that. So in that domain, I got into the election and I became the president of my junior doctor association. And that week when I went back to Lucknow, my home, my father probably had some such image in his mind about what netagiri means. And he cautioned me that life mein na, कई बार जब बहुत हाई पे होते हैं, it is setting up of a big fall. So you should always be very cautious. And in Hiba's terms, UP parenting was typically on full flow. That he told me that don't think that all this, what happens is success. And therefore you should be very cautious how you take this. And it's always a direction where you will get into some friendships or circles which will not be very progressive or I would say that take you forward in life. So I'm just giving you a word of caution and all that he said. So every height may be embedded with a fall. So what he did not say, and I heard it, that every fall is probably also embedded with some opportunity and something which will it bring good in life. And when I look at my life also, and recently I heard this talk by Mr. Alphonse, who is a member of parliament, and he was a retired IAS officer, and he was telling the audience that in my class 10th exam I had 42% marks, and I was dumped as the dumbest person in the family. And 5 years later, I topped the civil service exam in the country. So he said that that fall made sure that I wake up and I realized that what happened. So this is what typically happens. And what I learned during my so-called Netagiri and presidentship, that multitasking, collaborating with people, understanding, actually in that role, when you talk to so many people, stakeholders, administrators, faculty, there's a lot goes on. And if you get into that role, a lot happens. The other way, which traditionally it had been viewed as, was that typically leaders flex muscles, get away with a lot of things and got of nuisance and favors. And then, so as a word of caution, what I was told, I used that to my best ability and made sure that I make the best of it. And every situation I ask, what is my role? What I can do best for this? And one of the fallouts of that thing was that I have got a punishment posting from a head of department. So typically the faculty does not like people in these roles. So, and I will not go into details, but I would say that, so out of my 3 years of surgery training, I spent 2.5 years into cancer, neuro, and burns and plastic. So this was called, in a way, super specialty posting, but in reality, these are called punishment postings. And believe me, I found the purpose of my life in these postings only, because general surgery in those days in 1986 was as primitive as oncosurgery was, or oncology per se was. It was very primitive. There was no minimal access, nothing. And it was very, so in fact, just to give some glimpses of what all we did in that. So I got oncology posting for 1.5 years out of this 2.5 years. So it was like the most, I would say what people thought was a punishment in a big way, in fact became an opportunity and real purpose of my life, because I immersed myself in those struggles, in these people's struggles. And while I did that, in fact, I remember for one patient, I traveled to Delhi to find out what more we can do, because there was nothing available. And all these discussions and discourse, we got into UICC ke manual mangai, a lot of things I got. And two of us, me and Dr. Vipul Sood, who is presently at Batra Hospital, we actually invested a lot. Both of us were punished for different reasons, but both of us collaborated and created this. And that is how. So I had this situation where I could have become very pity to myself and would have got isolated from the whole team. It happened the other way around, that I looked at that as an opportunity and invested in a significant way and found and discovered oncology, and that became the purpose of my life. So what I realized, that life actually is like a pendulum. In different roles, you are fluctuating between what a leader has to do or what a follower has to do. In fact, in both the situations, even as a follower, you behave like a leader at times. And even as a leader, you have to have that intent to be a follower and listen to the people who are working with you, because that is where you'll find further direction. And I have written that. So once, and in fact, our children, our homes, everywhere we see this all the time. I remember my son, when he was class 10th board exams, before that, he was not going to school for some time. And one day he got a message from the teacher that if you not coming, then either get a medical certificate or you will be punished or whatever. So I told him that medical certificate de dete hain, typical parenting behavior ki de dete hain certificate. So I wrote a certificate, he was unwell, this, that, and karke de diya usko. So when he was getting off the car, he dropped that letter there. He said, "You are telling me to tell a lie. I will face it the way it is." So frankly speaking, हम सब कभी-कभी ना vulnerable होते हैं, succumb कर जाते हैं, situation में get away करने के लिए करते हैं. But honestly, unless you face the reality and you stand up each time, you don't develop the muscle to stand up at the right time. So that is what goes on and on and on. So likewise, when a diagnosis of cancer happens, we all get struck with it. In a sense that we feel that probably that's the worst thing which has happened. So typically people club all cancers into one bucket, all stages of cancer, all types of cancer, everything is clubbed as one, and cancer sounds like a death warrant. In an attempt to protect the people and our relationships, we end up hoarding information. We end up talking in a manner, in a very, what I should say, protective manner, that shielding people from reality. And we lose the opportunity which lies in talking, making yourself vulnerable, exposing yourself to the conversation, and actually building strong bonds. If we actually build on these conversations, it may lead to much better opportunity. And I'll show you how it happens, what goes around. And And so from a diagnosis of cancer to treatment of cancer, these are the dots which happen. The blue picture is a projection of the dots, that you are diagnosed and you get treated, and then you have a fine life, you're in follow-up, or suppose a recurrence happens or progression happens, whatever happens. But the real life is in between these things, that connecting the dots. What happens when we are between these episodes? What chemistry we create, what opportunity we create, how we share knowledge, all those things lead to the real utilization of that when that moment comes. And I believe that authentic joy and of sharing and inspiration for next generations comes from how we react to those challenges, to those situations, whether it is cancer diagnosis or whatever. In fact, I would say, go a step forward and say that in all our families, there are some stories from previous generation, which is in certain ways inspiring for the next generation, or tales which are told down families. And those are all moments where people talk of sacrifice, people talk of courage, people talk of humility and all this. So typically when somebody goes through a difficult situation in a very strong way, or in an authentic way, or something which is inspiration for others, that also is looked upon with a lot of, it inspires people, not the outcome, but how you reacted to the situation. That's also very important. So I will just briefly cover what is coming up in a certain, that what is an authentic conversation, what happens in a crisis, and how we can navigate through this in a crisis. Now, I want to emphasize that this is not something which is a prescription for everybody to follow. This is just something to think back, to introspect, to think upon it, introspect, and how we can use these things or different things to make sure that we are able to build relationships through difficult situations. So actually, authentic conversation has 4 components. First component is, what is the intent of that conversation? Whether the intent is to help or to harm. Now, I'm sure nobody will say that the intent is to harm, but you ask 5 questions, why you're doing this, why you're doing this, you will come to the real core of the reason. And sometimes it is not harm, but it is a meaningless, subtle way of undermining somebody or saying something which keeps cropping up all the places, everywhere. Workplace ले लो, घर ले लो, सब जगह होता है. So typically हमें हमेशा question करना चाहिए, what is my intent, what I'm trying to do through the end of this conversation. How do you want to see that at the end of this conversation, what should it be? It is something intended to build relationship and to solve the issue, or I want to win that moment, win that argument, win that discussion and get over it and feel good about the moment, or you want to build a relationship. Is it there to embarrass somebody, or to have given open platform, increase the shared knowledge pool and coach on the basis of that? What is it? And a lot of this depends on the depth of the relationship. So I would say that every time it is not in the same place, but what one can easily do is that what is the intent of the conversation should be clearly defined in person's mind. And once that is clear, it will help you give direction. Second thing is a genuine understanding of the situation. For example, somebody comes and tells you, कीमोथेरेपी के बहुत साइड इफेक्ट होते हैं, कीमोथेरेपी नहीं कराना है. जो बंदा बोल रहा है उसको कीमोथेरेपी के बारे में कुछ पता नहीं, उन्होंने 2 मरीज देखे हुए अपनी लाइफ में, कोई अंडरस्टैंडिंग ना डिजीज की है ना सिचुएशन की है, बट ये पता है कि कीमोथेरेपी नहीं कराना है या बायोप्सी नहीं कराना है. एज अ सर्जन वी नो दिस ऑल द टाइम कम्स अप. So if you don't have a genuine understanding of the situation, you cannot have an authentic conversation, and you should not be given importance or position. And if you want to invest in that or give that guidance or involve in that conversation, then one has to upgrade for the role. For example, if in a home there's a situation which I have no understanding of, your children are going through something or whatever, then you have to first patiently listen, hear out, understand, and also upgrade yourself. What is the exact situation, where they are, what is the spot? And then probably you will be able to play the role and do what is called an authentic conversation. Third important pillar of an authentic conversation is a mutual respect. We all know that in a doctor's clinic, how patients go into depth, into details of medical history. What all is shared there they might not have shared with their partners also at times, and also with their close family and friends. So that is a relationship of absolute trust where safety to share is accepted and is a norm. Now, if you take it out of the clinic, this is a professional domain where this is a accepted norm. So somebody you don't know, you're meeting for the first time and you're sharing so much information based on the position which that person is in and based on the relationship. In day-to-day also, all of us build a relationship where unless there's a safety to share, this authentic conversation does not take place. If people are worried that sometimes this information will be used at the wrong place with the wrong purpose, then it will never get into an authentic conversation. So this is the third important pillar. And the fourth thing is empathy. Whether there is listening with understanding or listening for the sake of listening. Is it just ticking the box, or you are invested in the situation and you want to understand and help, and everything comes out and you're in the moment there? If these four things are in place, only then one can have an authentic conversation. Now, we can use this in different situations: how to break the news, how to talk to your children, how to talk about a recurrence, how to different situations. Especially every situation is unique and every personal situation is also unique. But I think these four things form the pillar of any authentic conversation. And that is very important that we tick all these boxes, all the four boxes, and make sure that we are ticking all the boxes. Now, it is important to understand that sometimes these authentic conversations become crucial, and in some other times they actually become very difficult. So a crucial conversation is something which is when the stakes get higher. Now, every conversation, in fact, 90% of the conversation which you have on routine basis has very low stakes. It's a day-to-day conversation. Do this, do that, or whatever. But in 10% situation, it becomes crucial, where you have to do it within a time frame. The stakes are high, and if you don't act in time, then probably you lose the opportunity to not just fix the relationship, you can also lose the opportunity of strengthening or using to build the bonds. And it becomes difficult when the views are opposing. So on one side, stakes are high, emotions are involved, and when the views are opposing. When the views are opposing, it becomes a difficult conversation. Then you have to have different sessions and invest in it in a manner to get into collective results. So these things happen in workplace more often, difficult conversations. Sometimes in home environment, when looking for common purpose, चाहे वो बच्चे का admission कराना हो, what is the priority list of schools से लेके whatever you say, so many situations, how to choose a hospital, which doctor, how much you trust on Google, how much you trust on feedback. So this keeps happening all the time. Now, if you have ticked all the four boxes, then you go on to the next fourth and fifth, and you can use these situations and also use your level of relationship or the rapport which you have to solve the problems. Now, outcome of an authentic conversation is an authentic relationship. This is not a relationship which we see on Facebook. It's not a relationship which we see on WhatsApp groups, where people are all the time talking and also investing without having a relationship. So sometimes these groups are very meaningful, sometimes they're supportive, but in a lot of situations, they become more episodic and not linked. These are relationships where you can call up a person at 1 a.m. in the night and seek help, or if that person does not seek your help in a difficult spot, you feel that what have I done that I'm not worthy of this relationship. So this is where I would measure an authentic relationship. It leads to a lot of empowerment. It leads to resourcefulness of the whole of the family, of the individuals. If you can reach out to 20 people at 1 a.m. in the night or 3 a.m. in the night, you know what it means, where you are and what spot. So the outcome of authentic conversation is very, very valuable, and we should all build on this as we go along. However, whenever there's a crisis, when there's a difficult situation, we want to avoid anything. And the main reason for that is that we want to, again, go into the mode of protecting from the information to protect any trauma, any injury, and things like that. And what is typically happens, a fight or flight response happens. You want to just bury your head and hope the storm will go away. while you all know in reality it is bound to come, it is round the corner, it is going to happen, but delaying too much leads to a more problem, or a fight mode that the emotions take charge of the situation and the responses are all absolutely more like a violent response than like a credible response. Now, this is typically why we hold this, because we don't want to have a situation where there's I'm not able to hold it. Recently, I heard this conversation by a leader who said that when George Floyd happened in US, so nobody in the companies and organizations talked about the racism the way it is presently handled in US. And says, like so many things happen in India also, where we don't want to have this conversation because we feel that we never handle the situation. The situation, or somebody may ask a question which will be very difficult to handle. So we just keep avoiding, and typically that leads to a conversation, a situation where there's a hidden uncertainty in the environment, which gradually leads to some form of breakdown in different situations. So this is what leads to lost opportunity, I would say. Now, if you are not having the conversation, that also is not good, because then it leads to mistrust, whether it is keeping the information away from your children or from your parents. I have learned so much from my patients. For example, I know of situations where a young teenage girl came back from school crying because she learned in school that the mother is being treated for breast cancer. Now, somebody carried the story there, and she came back crying that why I was not told, why my friends know before I know. And nobody has an answer to those things. And this is one example. So many things happen that leads to mistrust, leads to anxiety. We are not able to leverage the support we have at hand. In fact, if we use, or rather empower our children who are going through this treatment or going through these situations, a lot of times I would say that they come out wiser and they get prepared for life. And I can only say that I have seen so many times young kids today, young when I'm saying anything from 12 to 24, whatever you call it, they are all invested into doing the homework for the family, for the parents, to find out what is the best way to go about this, what are a list of questions. And I deliberately in my OPD ask these young people, what do you think of this situation? Because I've realized that a lot of new things come up which they are aware of, and they're talking or wanting to know, which I am not aware, or people have not thought about it. So if you are not having this conversation, you're losing the opportunity to engage, to strengthen the bond, to use that resource which is very much at hand, to help them cope with their situations whenever they are in any difficult spot. And also, on the other side, building mistrust or leading to anxiety and lack of support. So it is important to share. And how do we do that? How to navigate through this is something which is what we are here for. So as I said, the first 4 things are critical. If you have ticked all those boxes and do it with patience, we can go through special situations. Each situation is, as I said, unique in certain ways. But if there's empathy, there's intent is clear, and one is understanding the situation, invested in it, and willing to support in that situation, one can actually, it's not such a difficult thing. Just pause, share. Just sharing itself leads to problem solving and solutions. And it's a step-by-step process. One doesn't have to download everything in first go. One can discuss this and go step by step and build it. For example, if we are discussing a situation, a cancer situation or diagnosis with children, it is important to gauge that for a particular age, depending on the level of and maturity of the age group and the child you're dealing with, you have to break that session into 2 or 3 if required or whatever. But it's important to make sure that no false information gets percolated. It is authentic, it is real, and and the children are understanding. You don't have to scare them. There should be always hope. There should be always positivity. There should be always engagement, and not just the dark side is painted. Now, in oncology practice, one of the critical thing is, how do we break the news to the patient that what is the stage and type and everything? And we all, as oncologists, have faced that the family would call us and tell us that please don't talk, please don't share, please don't do this and that. And my personal experience is that not sharing has always led to a situation where the person comes to know through unreliable sources, or a lot of times people say that I will share this at home and prepare him. To which my always concern and caution is that, see, you don't understand full oncology, so you can't answer all the questions. And that will lead to more mistrust. It is better that we do it the way it should be done in a professional. So to each person and each family, their own this thing. But having said that, it is important that the sharing happens in an environment where all these situations are understood. Now, after the treatment, all the side effects of treatment, everything is over. And when people go back to work and go back to family, this is another situation where people are able to find it very awkward moments. And that is typically everybody is looking at them with a, I would say, no, they are not looking at it in a different way, but they're not able to connect. They don't know how to empathize what is sympathy, and people don't want sympathy. So there's a very complex dilemma going on. And I remember this, one of my very old patients, she was a bank officer, manager, and she was treated for breast cancer way back. And she would say that wherever I go transferred or whenever a new person joins, I always tell them upfront that I've got breast cancer, I got treated, and please get all your mothers, sisters investigated, look for this, look for that, cancer is a treatable disease, I am cured. And she will take it in a very positive spirit. So I'm not saying one has to do it this way, to each person their own way of doing it, but I'm saying that the one who is more enlightened or more aware is the person who will go out and share that with more confidence. And the more earlier you share with confidence, the better it is in terms of strengthening relationships and helping the whole society and environment at large. Now, the situation of relapse is another thing which is very, very difficult. And for that, I would say that whenever a relapse of treatment happens, whether it is stage 1 cancer or stage 3 cancer, or whether the probability of cure was 98%, still 2% relapse, or there was high probability of relapse, whatever. Whenever that happens, there's a big question mark in everybody's mind. What else you could have done? How to break this? How much is the life expectancy? How do we use this time? And that leads to much more anxiety than any situation, not even for diagnosis and treatment. This is the most difficult. I would say for this situation, in today's world and time, there are a lot of opportunities in terms of treatment, in terms of new way of investigating and evaluating the situation. And therefore, like in earlier situation, it is important to relate and connect with the team with all relevant questions of what else is possible. And earlier also the same approach comes, but here it becomes even more important because the standard of care somewhere gets lost. And then you are in an exploration mode. And I would say that there's another way situation where often a lot of new learning happens, if I can say that. New learning happens for all of us. And if I can put all this together and say that post-treatment, and I've said this earlier also several times, but I've realized that most of us get 2x or 3x or 4x. And this example that wherever you see a cancer hospital, whether it is Dharamshila or Rajiv Gandhi or Tata Memorial or Cancer Institute or GCR, wherever, most of them have some seeds which were sown when the caregivers went through the journey of treating cancer. And this is really something which I never get over it, because I realize that something unique happens in that journey. A lot of impossible things become possible. Very ordinary people, they think big and they're able to do it because once they have gone through this care in such a short span, they actually invest a lot into the future generations and all. And I want to give the example of Anchal Sharma is one of the caregivers, our survivors, who is part of this group. And I remember when she came to us first time, she was a very timid girl. I don't know whether she's logged in here or not. but she was very timid, and we would say that this treatment is very complex. But believe me, while on treatment, she started food support for people who are going treatment at AIMS. She started a lot of new things, a lot of patient support. And recently she has launched her own NGO and a Chetna NGO and other things. So she, like so many of you here, has evolved to a next level of looking at others, even the active support group members. It's not easy to take time out, day in, day out, support people who are going through the same treatment and trying to do something from your own personal time, your family time, your professional time, whatever, and doing that. So these things are possible because the challenge of cancer, the journey of cancer, the relationship which you've built, that inspires us to do more and to evolve from there. So this is what I would rate as an authentic conversation or a crucial conversation which we need to have at the right time, at the right time. And I hope all of you recall why this talk was fixed. There was one of our friends in the group who had put a post of a situation that limited time is there. And I would say, so that is something which we don't want to talk, we don't want to discuss. And I will encourage you to visit this talk by Randy Pausch on the last lecture. So Randy Pausch is a scientist who was treated for pancreatic cancer, and when it was diagnosed, he was only 46. And he had metastatic disease. And he said, doctors told him there's only 6 months to live. And in those 6 months, what he did, he had not done that in 46 years of his life. And I don't think most of us achieve that much in a full lifetime. And why I'm saying that, because he was committed. He had 3 children. And if you look at this talk by Randy Pausch, in the end, he says, this talk is not for you guys. It is for my 3 children who are 6 years and 3 years and 18 months. So when they grow up, they will see what life is. So likewise, even those of us who get a recurrence or are in a situation of failure of treatment or whatever, their children, their future generations will be inspired by how we behave and how we reacted. And also those of us who have gone through the treatment and supporting others and investing more and have grown into a 2x or 3x role, that also is an inspiration for people around us and our families. So I think Bhagwan na kare, we have to go through the treatment or are diagnosed. But if this has come to our table, if this has come at our door, and we have to go through the cancer diagnosis, treatment, and the journey, so be it. We can't change that. What we can change is our response to that situation, and that can only be done through authentic conversations, authentic credibility. And this is not just applicable for this situation. There's something that's applicable for every day, every moment, every situation in the whole life. So I want to thank you with this, and I hope it was of some value, and then we will discuss through Bhuvan's panel discussion. Thank you. Bhuvan, are you there?
Yeah. Thank you so much, sir. And I think you've just said the president right. So, मतलब मेरी भाषा में माहौल बहुत अच्छा set हो गया. So the plan moving forward would be to have those authentic conversations and understand why do we need to have them at all. As in, की ज़रूरत क्या है? So let me just begin. So we have Hiba with us, we have Dr. Nikhil with us, we have Dr. Sandeep, Batra, and Dr. Dodul. And what I've done is I'll be speaking to them about each of their area of specialization and pick up those special points, the special focuses of difficult conversations, which will eventually it'll give us an example. Why is it important and how do we have them? And it'll be really great if you can drop in your questions if there are in the chat box, and I think we'll be able to take it. So coming to you, Hiba, recurrence or death, why should I think about it? Why do I need to talk about it? Isn't it a classic learning that think positive? Why do I need to talk? Why do I need to think about negative? And why do I need to talk about negative? Because it just goes against the classical teaching. As in, what's the need?
Thanks for asking that, Dr. Bhuvan. And that's a question I daily struggle with myself. So I'm going to bring in a bit of my personal side here as well. I think that when we talk about difficult emotions or difficult thoughts in general, we are so conditioned inherently by society to just think positive, be positive. And we have seen this a lot during the pandemic, right? There was so much grief, there was so much loss, and you would get these messages: be positive, be productive. People are, running their organizations, they're flourishing, billionaires are getting more billionaire, and things like that. And you realize that it was creating a lot of pressure on people, whether you're a patient, whether you're a caregiver, whether you're just somebody who's trying to survive a job, right? So we call this term something that's called toxic positivity, that you are suppressing, or indirectly or directly. Again, Dr. Harit talked about intent, right? So I'm not doubting someone not trying to make a positive impact on people, but what it does is that if someone is going through grief and anxiety or fear, these emotions automatically are termed to be negative. And so when we grow up looking at gussa mat ho, don't be angry, don't be jealous, sometimes you see someone happy and you have an imagination of what my life could have also been. And that makes you human. All of us have these core emotions that we constantly fight with. So when you ask me why we shouldn't talk about it, we really should, because you're human, you're not a superhuman, none of us are. And you will come with these ups and downs. You can't always be happy, you can't always be grateful and positive. But when you go through these unpleasant moments, the gratitude then is a lot more seen. We all fear for our lives, all of us. The COVID, I think, pandemic has redefined that for us. I can't plan next 5 years of my life, to be very honest with you. I only plan 2 months at a time, ever since the last 2 years, because of a lot of grief that we all have seen. And so I just know, okay, academically, I have to do this in July, that's it. I can't plan January. I don't even know if a visa that I've applied for will come, right? So individual definitions, individual meanings is the gift that I have as an individual, whether you're a patient, whether you're a family, whether you're dealing with loss or having lost or even recovered. You will have your meanings and definitions change with time. So that's something that I feel.
So let me paraphrase it. What you're saying is the conversations need to be had. We are not superhumans. We eventually, all of us will die, if not because of cancer or something else. So eventually we all going to die. And whenever we are in that situation, we might as well face it than not face it. And then we might as well talk about it and might as well plan about it than not plan about it. So I'll tell you what, it's a constant conversation which I kind of have with myself. How do I deal with the anxiety which comes with these thoughts? So I'm sure each time we think about, will I have a recurrence? I can very well tell myself it's okay. I need to be prepared for a recurrence and I need to be prepared for my death. But then I also need to deal with the anxiety which comes with it. So, in a very short sentence, could you just tell me what is it? What is it that you need to tell yourself when you face those anxieties, and how do you deal with that?
I think if I speak as someone that I also deal with, the first thing you need to ask yourself, can I control the situation? Is recurrence in my control, or is a regular checkup with my doctor in my control? You already have your answer. That I'm going for reviews every month, every 3 months, every 6 months. That's something that I can control. I can be regular with my therapy, with my medication, with the doctor's advice. But can I control what comes to me 5 years or 5 months or 5 days from now? No. So is it worth stressing over it and bringing upon anxiety, depression, fear, constant jitteriness? You have your answer. And of course, that's no.
Fair enough. So I think what you're saying is when the things are not in your control, you might as well, live with it. So what I've done is I've started to learn to live with my anxiety. And I think that's where it is. So Dr. Harit, you being the most senior member of our team, and by that, I don't mean that you are the oldest one, but then you are. So, I'm sure, you probably would have thought about writing a will. How did you face that situation? How come you asked yourself? So when you're saying that you will write your will, and by chance if there is something left, I am your adopted son also. But then what I'm saying is, how did you face that fear of I'm going to die, and when I'm dying, this is the will I want to leave? So I'm sure that comes with a realization and accepting the fact that I'm going to die.
I think when you take a LIC policy, that is the first time you actually accept that. And that is the first thing most of us do. And I think when I started into practice, so this realization, for example, when I had my son was born, for first 6 months, my behavior was a bit changed. I became very protective and I was to worry that mujhe kuch ho jayega. I felt responsible for somebody who was brought to this world. And then I got over this, that भैया ये मेरी जिम्मेदारी नहीं, तो दुनिया है, सब चलता है, ऐसे ही चलेगा, हम भी आएंगे जाएंगे, things will evolve. But it takes time to absorb. So I fully, frankly, being a doctor and being an oncologist, it's much more easy to accept. And today, I would say that so many people much younger than me in age come with advanced disease, that every day when I go home, I tell my wife that only you are lucky if you are healthy. That's the only thing. Whether you are on this side of the table, that side of the table. So that acceptance, that writing a will or coping with it, or accepting that death will come or death is a reality, I think as adults, it's not so difficult. And as you said, writing a will, I agree that when we had this conversation in our home also, and there was in broad some understanding ki kya zarurat hai iski. But then everybody knows that sabki zarurat hoti hai, and you face this more often as an oncologist than in any other specialty of healthcare.
So I think that's very well said, that eventually we all as adults have learned to accept that we eventually will die. And, you know, when we are facing that situation, again, it's better to be prepared. And there is no harm talking about it. There is no harm bringing about it on the TV. We may, you know, you may not want to bring it on a WhatsApp group. You obviously would want to bring it in your mind and in your home. So, you know, moving ahead, I'll go on to Dr. Dodul. Dr. Dodul, you are a prominent head and neck radiation oncologist also. And, you know, there are these clinical situations which possibly, you know, as a caregiver or as a patient, I may have a difficulty bringing it about. Head and neck patients, they have a lot of foul smell which come out of the mouth. And eventually it's difficult for them to talk about it to somebody because it's generally something considered unhygienic. But, you know, how do you tell your patients, and how do you bring about that conversation which is more meaningful and more positive than, you know, basically how do you go about it?
See, Dr. Bhuvan, I'm just taking a lead from the previous conversation. What we are actually discussing about cancer is like we all know it's like a hanging sword, and the moment someone is diagnosed, they know about it. In a previous discussion, somewhere I told that pain comes from inability to accept. Acceptance is required, and definitely that acceptance comes from discussion with different people at different levels. That may be friend, that may be family, that may be psycho-oncologist like Dr. Hiba. And there is another concept known as positivity. We all do health insurance, we all do life insurance, but then every night when we go to sleep, we plan for the next day, that we have these 5 works for tomorrow, and we plan. That indicates positivity, inner positivity in all of us. So even when that sword is hanging, we all remain positive to get up from bed and start a new day. So I think we have to work on that also. Now, coming to your specific question about this head neck cancer, I was thinking that we always discuss about things which are very, very common. Now, something which we never discuss, this is, I am telling from core of my heart, we never discuss what happens to psychosexual things in a head neck cancer patient. We all discuss psychosexual things when it comes to gynecological malignancies or breast cancer, but does it impact psychosexual aspect also? Because every cancer treatment or head neck cancer treatment leaves some scar. It may be a disfigurement because of surgical effect, because of effect of radiation. It may lead to lack of voice. It may lead to inability to open mouth properly. It may give rise to some unhygienic condition of mouth. It may change the look of a person. It may be a man or a woman, but we all know that looks are important in our private lives also. How do we deal that? I don't think, or I don't remember anyone has spoken to me regarding this, but I strongly feel this is one of the issues we need to discuss. Now, again, here comes the role of acceptance. The partner needs to accept, both the partners, the patient as well as the life partner, they need to accept this fact that yes, life after cancer diagnosis, head and neck cancer diagnosis and treatment will not remain the same. But then how to keep the relationship going? How to keep that love, that affection, everything keep going? That's a big thing. And here again comes the role of counseling, sitting together, discussing together, and finding newer ways and meanings of life. I think Dr. Hiba can also give her input.
So I think me and Hiba had this conversation. I think because when I was doing a support group meeting last year, and I genuinely asked her that how do you go about being attractive to somebody, because vanity is important. We may not want to talk about it, but all of us we all have a certain degree of vanity. We all want to look smart, and there is always an attractiveness to it. And that's the reason I genuinely asked her, how do you go about it? How do you reignite your relationship? And she told me in a very, very honest and a candid way, it's about conversation. It's about intimacy. Is not only physical. There is so much more to intimacy. And I think, Hiba, I still remember, and those words are imprinted in my mind. Do you still feel that, or is there something else you want to bring about?
Not at all. Thank you for sharing that, Dr. Bhuvan. I actually had forgotten about that conversation, but it was a very interesting one that I remember. And I agree. I feel like communication can be in so many forms. Communication can be not just verbal. Communication can be gestures, the way you look at each other, the way and intimacy doesn't have to just be between partners, right? It can be between parent and child, siblings, friends. And I think that just talking to each other, even if it's, Dr. Harit mentioned vulnerabilities, that sometimes we carry so many insecurities that we end up projecting the negative feelings onto the other. Projection is basically when I'm thinking something at a deep level, which is negative, unpleasant, and I don't want to say it, or I don't even know or realize that's happening, I take it out onto someone who I feel is doing better. Whether it comes out as anger, irritability, just very annoyed with each other, that creates friction. So again, I think what Dr. Bhuvan was saying earlier in our conversation, communication helps ease intimacy between two people as well.
So Hiba, I have a question.
One second, let me just, Dr. Dodul, I think we are running short of time. I'll come back to you. Let me just go to the other. So Dr. Batra, you see a lot of gynecological cancers, and I think the sexual proximity and having a physical relationship is an individual part of, it's an important part of human life. How do you deal with do people come across to you in your clinic, and do they have a conversation about it? What is it that you can tell us, and what is it that you can bring forth when it comes to maintaining a physical relationship as a part of gynecological cancers or cancers in general?
I would just like to tell two small stories, a little bit tragic, but they will pin the point. So one story is about a young couple in which the male partner has got a colon cancer, which is an early stage colon cancer being treated. Another story is about a young couple in which it is about the female partner who has got a germ cell tumor, which is an ovarian tumor. Now, both of the couples, they are arranged marriage, happily wed, and incidentally, within 1 year of their marriage, they are diagnosed with this problem. When the problem starts, there is a full family support, full support from the partner. It's like made for each other couple. But once we complete the treatment, then in about 1 year's time, I noticed that the couples, they are not coming for the follow-up as a couple. The patient in the male couple part, in which the male was a disease patient, which is cured now, was coming alone. And the same with the female part, the female partner was cancer survivor, she is coming alone. So when poked, then the thing that came out was that the male was feeling very guilty that he has had a colon cancer, he had a bag, he was not going to procreate with her wife, with the fear that he may transfer his disease to her partner. The same way, the female, though she was not very feeling guilty of passing on the disease because she was cured, she had issues like vaginal dryness and lubrication issues, which were not allowing her for a successful procreation. And the things had turned so to the point that it had reached the point of divorce. Now, luckily, timely intervention in the form of discussion with them, calling up their partners, explaining them, getting their sessions done, that led to non-breakage of a very, very good couple life. Now, that stresses the point. These are the most ignored things, particularly in our society. If you see the Western world, 50% of the people, whether they're surviving from the intestinal cancers or the gynecological cancer, for that matter, breast cancer, they do not talk about the sexuality or the sexual function or the intimacy. In contrast, I would say this figure will be more than 90% in the Indian society. But as you say, intimacy is necessary, it's including the physical intimacy. So these are issues the most ignored. And usually there is a policy of don't ask, don't tell in the oncologist office or clinic as well. Unless until someone asks for it, the information is not provided by the healthcare worker. So I think initiative has to be taken both from the patient patient side as well as the clinician side to discuss these issues, which are important issues and which have been ignored till date in our treatment practices.
I think that's very well said. So, Radhika, I think you should all take a point. And, what Sandeep sir said is very right. And, we've been all avoiding that conversation. In our support groups, we may be supporting each other well, but then, when it comes to the real support group, I really, really think that, as a cancer somebody who's been suffering from cancer, as a person who's also has gone through that, and what did they do to overcome that? Somebody has there is a dyspareunia, or there is a penetration which causes pain. How do you deal with that has to be spoken about. And, it's the only way to speak about is that you bring forth it. And, you may not want to do it openly on a WhatsApp group, but then there is a list of people on that survivor group, and all you can do is just ping somebody personally, ask on a WhatsApp group that, is there somebody who has been suffering from a gynecological cancer and this is what happened to me, or, can I speak to you privately? And I don't think as an oncologist, I probably would be able to give as good as advice as somebody else who has gone through the same thing would be able to give it. So I think the only way forward is communication, as Dr. Batra rightly said. Coming to please.
Yeah, Dr. Harit, you wanted to say something?
I don't think patients can initiate that conversation unless there's a professional setting or environment. So I think that is something which I think Hiba should help in assisting in creating that environment and opportunity, because that has to be in a very professional way.
Yes, may I just say something here? We have had quite a few support groups regarding sexuality, whether it was just gynae or it was a general sexuality session with some very sensitive doctors, and Hiba was there. But I think we are so conditioned by our cultural and social norms that we hesitate to discuss something like this. In fact, I came under a lot of flack, and Hiba knows this. I came under a lot of flack by the patients and the caregivers for even arranging such a session. And that was some time ago. So, sometimes we do it only for women. We don't bring men in, but then that seems to defeat the purpose, because you need your partner there to know what is happening with you. So this is not just a sexuality thing, it is our conditioned behavior that inhibits us from saying these things. Also, just taking what Dr. Harit said about the will. I was talking to him about it. In the West, we have the hospitals and the centers arrange what we call Make a Will Week. So the patients, whether they are OPD patients or whether they are in advanced stage, are encouraged to make a will, because it's the normal done thing, whereas in our society, it's not. So some of these shells we have to break to come out of our social and cultural conditioning. So that's what I wanted to say. Please,
I think
Dr. Bhuvan.
yeah. So I'll just continue with I think Dr. Nikhil. So Dr. Nikhil, I probably me and you have had long conversations, and that's the reason I would like to bring this thing to you. I sincerely think that you have one of the most wisest advices to give, and your hair are not dye, they're actually white, by the way. So the thing is, when it comes to it, you deal with a lot of GI cancers, and most of the people who undergo surgery, they have some anatomical disturbances left. They may have a bit of rectal incontinence, or some of them end up having a stoma. young male who probably goes to office, it's difficult for them to, sit through the office. There's a lot of sound which comes out of stoma. There's a rectal incontinence which makes it difficult to sit for long hours during a journey, during travel. So how do you have these conversations with people in the, when they come to you?
So Bhuvan, I mean, I do have conversations with my patients regarding this, but it mostly I learn from them. Because see, there is no solution to most of these problems. We do have some medication, some exercises, some biofeedback training, which can help decrease some of these symptoms. But mostly they become okay with time or improve with time. Sometimes they don't become completely okay. But it's their journey in which they adjust to those circumstances. And what intrigues me about humans most is their adaptability. We are super adaptable to anything. And they have, everybody will have their different ways of dealing with the situation, which probably I wouldn't be able to come up with, because I don't know their social circumstance, I don't know their office circumstance, I don't know their work circumstance, but they do deal with it, and they are very smart in dealing with it. And eventually their quality of life comes back to where it was. So these issues are dealt that way, and we have to adapt to this as per our situation.
And so in general, because I think you have a lot of good advice to give also. So what do you think about, so basically what you're saying is acceptance. And as rightly said by Dr. Dodul also, that it's all about, eventually it's about acceptance and accepting that this is what it is. Also when we're talking about the chance of recurrence and death, what is your advice on that? As in, you think, how does a person deal with it? How do you feel okay with it? And how do you deal with that anxiety?
So you can't feel okay with it. Like when you think about your own life, everybody knows that you are going to die. There's no person in the world who doesn't understand that. And if we look at our behavior, we don't behave that way. Nobody does. Right? The world would have been a very, very better place if everybody would have behaved the way this reality is known, but we don't behave that way. Similarly, it's with our patients or with us. We don't consider that. Everybody don't consider that, okay, that distant future is not coming immediately. That distant future, everybody thinks is a distant future. Right? So when you think about these situations, you first want to say that I want to safeguard my family. That is one of the most important concerns in our mind. Like you would know that I am sometimes very much interested in personal finance, and your reaction to different things are different. Like as Dr. Harit said, that he got anxious when his son was born. When my daughter was born, the first thing I thought was, okay, fine, if I'm not there, what I'm going to do? So I realized one of the important things are finances. And there my journey started with personal finances. I wanted to secure their life after I'm gone. Right? So similarly, everybody have their things, and it's very difficult to deal. I mean, how do you deal with recurrence? It's something, you are going to die in some time. It's very difficult. But yes, we'll have to grow through that journey.
So Dr. Dodul, coming to you, I think you were also trying to make a point, and as I think we all of us agree that what you said is it's right on point, that it has to do a lot with the acceptance also. And can you just elaborate the point you were trying to make before?
See, Dr. Bhuvan, forget about cancer. The only truth after being born is we are going to die, and we do not know when is it. It's not that the cancer patient will die sooner than me. I may die sooner than the cancer patient. And there are thousands of reasons to die. Cancer is one of them. So we need to forget this fact. We definitely need to forget that we are going to die, and we should enjoy the remaining life. And we should utilize it to the best possible way. Now, someone can have their different preferences to define what is the best possible way. Someone can choose to spend time with their family. Someone can choose to travel. Someone can choose to do creative things. Now that depends on individuality. So that should not bar us from enjoying life. So acceptance has to be there. but then we should move forward. Now, planning becomes very important, as Dr. Nikhil was saying. And I fully agree that even when I do not have a cancer, I have planned. I made my will during COVID, and I believe COVID has taught us many things, that we can die anytime. And we are leaving behind the rest of the family, probably. We do not know. So we need to make their life secure and as painless and as comprehensive and planned as possible. Making a will is probably one of the easiest things we can do. And believe me, that makes things legally and officially a lot more easier. It does not take much. Doing term insurance is important, and everyone should plan that as well, depending on their age, their eligibility. And that will also give them kind of confidence that when I am not there, my family will not be completely ruined financially, because we know cancer treatment is a costly affair. So having those things in mind is very important. Planning those things on time is also important, but that should not let us down with the negative thoughts. We should enjoy the remaining life. And I reiterate, cancer is not the only reason to die. There are so many other reasons.
So I think
Bhuvan, I just want to add one point to what Dr. Dodul said very quickly. This is an observation that I've had in sessions and in the ward especially, when the doctor talks to a patient who may not be doing very well in that time and says, you know what, have you thought about legalities or finances? The ones who are willing to talk about, I've seen them get very offended with that doctor. Yeah. And it has come to me and I've been with the hospital for many years now. Every month, at least, I see somebody who said, how dare he ask me this question? It's because when you mention will, and when Dr. Dodul, Dr. Nikhil, Dr. Bhuvan, Dr. Harit, everybody, Dr. Batra, they talked about these very difficult aspects. It's a reality that you don't want to accept. Now, the reality for a patient in the hospital is that my reality might come tomorrow or day after. For me, it might be, I don't know if the pandemic hits me and my immunity doesn't. So I also feel like that offensiveness and defensiveness is to protect your own self. That's all I had to add.
There is a word known as the art of breaking something, breaking bad news. That's an art. Everyone is not an artist. Of course, we have to accept. There is a way to communicate. And being a psycho-oncologist, you definitely know that interacting and reaching to the right point, it needs many layers. It's not a straightforward discussion. I went to take the round in the morning, and after reviewing the reports, I started saying, oh man, you need to plan your life. That's not the way. It has to happen over a period of time, involving the patient and of course, the closest caregivers whom the patient trusts. In our country, we cannot exactly simulate the Western culture, where patient decides which one to be involved, who are the family members to be involved, whether I can disclose this or that to the family member or not. Here things are different. यहाँ पे तो patient आते डॉक्टर साहब patient को ना कुछ नहीं बताना.
हाँ बिल्कुल बिल्कुल बिल्कुल.
बस आपका ये part भी हम ऐसे ही निकाल लेना चाहते हैं. So here things are different, and we have to accept that reality. So involving them, knowing how to disclose the fact and how to involve the patient in this decision making is important. And trust me, I have done this. It's not impossible.
So
I think what we all are saying.
Dr. Bhuvan, yeah, please finish. And then I would like to bring in a patient here who is a stage 4 patient, and for her perspective. I can do it now or after you finished.
No, the thing is, I just wanted to, I have this, so we all have these experiences where, the family doesn't want to tell the patient. And I sincerely feel that when you know what you're fighting, the life is much more easier. The will is much more stronger, and, the strength is much more powerful. So what I sincerely believe is that know your enemy, let people be hopeful that they're gonna come out of it. Anyway, so go ahead, please, and I think we'll wrap it up.
So I would, this is not a time session, Dr. Bhuvan, so we can extend it if we need to. I would like to bring in a patient here who is a stage 4 cancer patient, and in fact, she is the inspiration behind today's session. Dr. Seema, I know you're here with us. Would you like to give us your perspective on today's topic and discussion?
Thank you, Radhika, for inviting me in. And I would like to start with the fact that most people are not ready to accept the reality. And many times it is the family who is overprotective. And actually the person would probably be able to handle it, but the family is being very protective. I really endorse, everybody spoke so well, and that is exactly what I had in mind. I've had a close brush with death many times over the last 6 years, but that doesn't make me not lose hope. Rather, I live my life to the fullest. Those who know me closely, they know that. Today also, I had gone to my clinic, I had done my dentistry as if all my patients I'm going to see and finish their work properly. But you never know when death will strike, not just to me, but to anybody else for that matter. So this is very important that one has to be hopeful, but realistic, and think beyond your own emotions and think for people whom you love, you'll be leaving behind. Like Dr. Nikhil said that he went in for finance, making the finance healthy for his children. Someone was talking, Dr. Dodul said about taking term insurance. Same is the thing, like maybe because I'm a single parent, I was divorced for so many years. So all my treatment plan and everything is totally in my own hands. So I take the decision. So that was a very, very primary thing. The day I was diagnosed with cancer, that is the same day I went to the bank and put in the nominations in all my accounts and things like that before even starting the treatment, because I didn't want my children to suffer after me, right? So we have to think beyond our own self, think beyond our own fear, and think about your loved ones who will be left behind once you are gone.
Thank you, Dr. Seema. Thank you. You've been an inspiration to many of us in the support group. Yeah, Dr. Bhuvan, over to you.
So I think it has been, I think it's been a very, very well conducted session, and Dr. Harit just set the ball rolling, and we have touched upon the few things which possibly I would want to touch more, and I would sincerely want that all of us as a group become really supportive to each other, because that's what the support group is all about. You know what probably you have gone through, I would have no clue to figure out all those things are. As in, there are. So I sincerely believe, as a medical student, the reason we do so many practicals, or the reason we learn our medicine in the body, is because you have managed a patient, you don't know how to manage it. Somebody who's gone through it probably knows how to deal with it best, especially the things which we don't end up talking about. So I think I would just like to say, communicate. Yeah, that's all about it. That's nothing else to it. So back to you, Sir Harit sir, and then I think we should be closing this.
Yeah, we can wrap this up, Dr. Harit. Last words, please. Dr. Harit, say something. You are muted, sir. You are muted, Dr. Harit.
I have nothing really to add. I think it was fantastic. I can only say that I will invite you all to watch this video by Randy Pausch. This is very, very inspiring video. And cancer journey is just one journey. Your life ought to be lived like that, through communications. And in fact, communications not just lay the foundation for individual relationship, they also build homes or break homes where there's lack of communication. They build institutions or break institutions. And what is the level of communication actually defines everything, whether it's a nation, whether it's across. So I think one basic thing we need to all strengthen is communication in the best possible way with positive intent.
Thank you. Thank you so much. Thank you, everybody, for joining in for today's session. Thank you to all the doctors and all those who have participated today. Thank you very much.
Thank you. Thank you so much for this nice program.
Thank you, everyone. Bye.
Thank you.
Thank you.